Hello and welcome to another episode of Med Madness, your go-to podcast for in-depth medical knowledge and insights. Today we will delve into a critical topic for medical students and healthcare professionals alike, chronic heart failure. Understanding this condition is vital as it is a common and serious health issue that affects millions of people worldwide. In this episode, we will explore what chronic heart failure is, its causes, symptoms, diagnosis, management and treatment options, and we will also discuss a real-world case study to illustrate these concepts. So, let's begin. Chronic heart failure is a condition where the heart is unable to pump blood effectively to meet the body's needs. This results in symptoms and signs of volume overload, poor perfusion, and eventually organ dysfunction. Chronic heart failure can result from a variety of underlying conditions, including ischemic heart disease, chronic hypertension, diabetes mellitus, valvular heart disease, cardiomyopathy, and chronic kidney disease. The pathophysiology of chronic heart failure involves a cycle of reduced cardiac output and compensatory mechanisms that ultimately worsen the condition. Key elements include reduced stroke volume, leading to LV volume overload. Eccentric hypertrophy, initially compensatory but eventually leading to contractile dysfunction. Neurohormonal activation. Increased sympathetic activity and renin-angiotensin-aldosterone system activation, resulting in fluid retention and vasoconstriction. Next, let's discuss symptoms and clinical presentation. Patients with chronic heart failure often present with progressive dyspnea, orthopnea, peripheral edema, and nocturia. Common signs include jugular venous distension, bibacillar lung crackles, a displaced point of maximal impulse, and an S3 or S4 heart sound. Moving on to diagnosis. Diagnosing chronic heart failure involves a combination of clinical evaluation and diagnostic testing. Clinical examination assesses signs of volume overload and reduced perfusion. Blood tests, including brain natriuretic peptide levels, imaging techniques such as echocardiography to assess ejection fraction and structural abnormalities, and additional tests like ECG, chest X-ray, and cardiac MRI are used to further evaluate the condition. Now, let's talk about management and treatment. Management of chronic heart failure involves a combination of pharmacological and non-pharmacological approaches. Medications include angiotensin system inhibitors like ACE inhibitors, angiotensin II receptor blockers, and angiotensin receptor neprilysin inhibitors. Beta blockers such as metoprolol and carvedilol, mineralocorticoid receptor antagonists like spironolactone and eplerenone, and SGLT2 inhibitors such as dapagliflozin and empagliflozin are commonly used. Diuretics like furosemide are used for symptom relief. Lifestyle modifications and preventive measures include dietary sodium restriction, regular physical activity, and managing comorbid conditions like hypertension and diabetes. Now let's illustrate this with a case study. A 65-year-old male presents with progressive dyspnea and orthopnea over the past 6 months. He reports increased nocturia and swelling in his legs. On examination, he has jugular venous distension, bilateral lung crackles, and a laterally displaced point of maximal impulse. Echocardiography reveals a reduced ejection fraction of 35%, consistent with heart failure with reduced ejection fraction. BNP levels are elevated. The patient is started on an angiotensin receptor neprilysin inhibitor, a beta blocker, and a diuretic. He is advised on lifestyle modifications, including sodium restriction and regular physical activity. To conclude, in this episode we covered the essential aspects of chronic heart failure, including its definition, causes, symptoms, diagnostic methods, and treatment options. Early diagnosis and appropriate management are crucial to improving patient outcomes. Don't forget to engage with our pre- and post-podcast quizzes to test your understanding of this important topic. Thank you for tuning in to Med Madness, and we hope you join us for our next episode.